Hi everyone, my name's Tom Peters. I'm a physiotherapist for myPhysioSA here at the North Adelaide Clinic. Today I'd like to talk to you about pain in your foot, and in particular pain in the arch of your foot. The most common instance of pain in the arch of the foot that we see here in the clinic is called plantar fasciitis, a very common injury. It's typified by pain that occurs on the underside aspect of the heel, very localised to that area and very sharp in its nature. Most people will complain that the pain is at its worst first thing in the morning when they start weight bearing on that foot, or also after a long period of rest when they get up from a chair or up from the couch. They'll find that the pain tends to be at its worst at that period. This condition is most commonly seen in people of about 40 to 60 years old. There's many different things that can contribute to the onset of this problem. Things such as type of training and the amount of training that you might do. Simple things like footwear, muscle strength and muscle length around the foot and ankle, amongst many other things. Unfortunately, by nature, this problem can tend to take several months to get on top of, but there are several different things that you can do at home that I'm hopeful will help to relieve your pain. Today I would like to talk to you about two simple exercises that you can do at home with minimal equipment that will hopefully help to give you some relief of your heel pain. The first thing I'd like to talk to you about is some rolling through the muscles and soft tissues underneath your foot. You can use simple objects like this here, a spiky ball for example. Alternatively a golf ball will do a similar trick. But for mine, the most effective way of performing this exercise is with a frozen bottle of water. So, rolling through the foot. As I've mentioned previously, you can use different gadgets. Spiky balls are really effective, golf balls, and my favourite, the frozen water bottle. Let me show you with a frozen water bottle. The reasons for using the frozen water bottle are twofold. First of all, you get a nice firm surface for you to roll the tight and tender tissues in underneath the arch of the foot. And second of all, the frozen water of course provides nice pain relief by icing down underneath the foot. Now, the amount of pressure that you'll put down through your foot is essentially dictated by how tender your foot might be at the time. So if you're particularly sore and you can't bear much weight, then a seated position with your foot on the bottle would be fine, or something similar to this. If you feel quite comfortable that you can apply some more pressure to the foot, then stand up, put the bottle down underneath your foot and apply a little bit more pressure that way. You might spend 2 to 3 minutes, 2 to 3 times a day as a way of releasing. Make sure that you're in bare feet, of course, when you perform the exercise to maximise its effect. The other thing that I'd like to show you is a simple stretching technique that goes really well with the technique that I've just shown you. So, after you've spent some time rolling through the arch of your foot with your ice water bottle, spiky ball, golf ball, it's time to give that arch a nice stretch. The tissues that we're looking to stretch are in and underneath the arch of the foot here. Its correct name is the plantar fascia. Now, the way you're going to do that is simply by placing your toes up the upper wall, or in this case a desk, your heel on the ground, and then gently rocking or gently pushing your knee towards the wall. You're going to try and maintain that position for about 30 to 40 seconds at a time, and I want you to repeat that 3 to 4 times. When you're performing the stretch, we're obviously aiming to achieve a sensation of tightness through the arch of the foot, maybe through your Achilles and calf region as well, that's fine. Certainly we're not looking to exacerbate any sharp pain in these positions. So if you've got pain in the arch of your foot, we'd love for you to try some of these techniques, but of course not all exercises work for everybody. So if you're having any problems or any concerns, please get in contact with us here at myPhysioSA. We'd love to help you out and get you back on track as soon as possible.